friends. So today we will be dealing with congenital heart diseases. Okay, as you know, in the last topics we had successfully completed our ischemic heart disease. That is, 4 parts we had completed successfully. By that, ischemic heart disease gets completed. And now I had got some comments like to take. Some of you are saying to take congenital heart diseases. Some of you were asking me to take congestive heart failure, but to be honest, congestive heart failure is a huge topic. It's a vast topic. Okay, so it has connection with so many systems. So I need some time to gather info from various sources, and then I will concise it and I will present it to you in a better fashion. Okay, so I need some time further. So before that, we will look into this congenital heart diseases. Here in this topic, I will discuss only the general pathophysiology that occurs in congenital heart diseases, what are left to right shunts and what are right to left shunts, and what happens in these two types, what are the consequences, I will discuss here, and I will tell you the classification of congenital heart diseases. Then following in the subsequent classes, we will learn specific conditions like what is ventricular septal defect, okay? Then atrial septal defect, like that we will discuss each topic specific in subsequent lectures. Okay, so now going to the congenital heart diseases. So first you should know what is congenital heart disease. Basically, congenital heart diseases that develops congenitally either since birth or may be sporadic. It may be sporadic, it can be sporadic, and most cases are sporadic only, and this usually leads to shunting of blood from left to right or right to left shunt. Now the question arises, what is left to right shunt and what is right to left shunt, and how to differentiate these two? What are the characteristic features of left to right as well as right to left shunts? We will be discussing the pathophysiology now. Okay, so now pathophysiology of right to left shunt. Let me draw a simple diagram now. Suppose this is the heart. Consider this as a heart. Actually, it's not looking like a heart, but just imagine this is a heart, and you have the 4 chambers. I am drawing it little bit simple so that it can be easy for me to make you understand, can easy for me to explain what is happening here. Okay, so these are the 4 chambers. Here you have the, wait a minute, I will change the color. Yeah, here you have the, which valve you have here? Tricuspid valve, right? And here you have bicuspid valve, that is the mitral valve. Suppose this is the left side of the heart and this is the right side of the heart. This is the pulmonary artery. You know, from the right ventricle, pulmonary artery arises, that is the pulmonary trunk arises. It will go upwards, but I am drawing downwards just to make this diagram as simplified as it can be. Okay, so this is the pulmonary trunk. Consider this as pulmonary trunk PT. Okay, now from the left ventricle, what arises? You have aorta, right? I am writing A, that indicates it's aorta. Okay, superior vena cava and the inferior vena cava will open into the right atrium, right? So IVC brings the blood, venous blood, from the lower part of the body as well, and SVC brings the blood from the upper half of the body, that is from head neck area. So generally what happens, blood from the upper part of the body comes through the SVC and enters the right atrium, and blood from the lower half of the body comes through the IVC and enters the right atrium. So the deoxygenated blood lands in the right atrium. Now from right atrium, what happens? The blood goes to the right ventricle, and from right ventricle the blood will be pumped into the pulmonary trunk for oxygenation to lungs. Suppose this is the lungs. Here you have the lungs. Okay, this is the lungs. Okay, keep it like this. Now then what happens? From the lungs, blood gets oxygenated and that will be transferred to the left atrium with the help of pulmonary veins. 4 pulmonary veins open into the left atrium, and they pass the blood from the lungs to the left atrium. Now from oxygenated blood travels from the left atrium to the left ventricle with the help of this mitral valve, and then from the left ventricle the blood travels through the aorta and circulates throughout the body for oxygenation of the tissues, right? So suppose there is a opening or defect in the interatrial septum. Okay, suppose, imagine there is a defect in the interatrial septum. That means there is a hole. In case of pattern foramen ovale, you will have a hole in the interatrial septum. Now what happens? Now as the blood is coming from the SVC as well as the blood is coming from the IVC, now this enters the right atrium. I am drawing with the black ink. Okay, so this blood will enter into the right atrium. They are lodging in the right atrium. And this blood, whether it's oxygenated or deoxygenated, they are the deoxygenated blood coming from the venous blood, right? Now this deoxygenated blood normally it should go to the right ventricle but here, as there is a defective interatrial septum, it goes to the left atrium. So what does it mean? The blood is traveling from the right atrium to the left atrium through the interatrial defect. This is called right to left shunt, and this also can occur from the right ventricle to the left ventricle. If suppose here there is an interventricular defect, okay, interventricular defect, then the blood which comes to the right ventricle, they will go directly to the left ventricle bypassing the lungs. Okay, so here imagine this is a case of interatrial septum defect. Some defects is present. There is a pattern foramen ovale, I will discuss it later. Something interatrial defect here that causes the blood to go from the right atrium to the left atrium directly bypassing the lungs. So this blood is not reaching the lungs, instead they are going directly into the left atrium. Then what happens? So the deoxygenated blood, without getting oxygenated in the lungs, they are shunted towards the left atrium. So it is called shunting of blood. Okay, they are shunted towards the left atrium and bypassing the lungs without oxygenation. Now this deoxygenated blood is present in the left atrium. What happens? This blood, deoxygenated blood, through this mitral valve, it goes to the left ventricle. And now from the left ventricle, it travels through the aorta and circulates throughout the body. That means the deoxygenated blood is getting circulated throughout the body, in short, right? So as the deoxygenated blood is circulating throughout the body, oxygen is not reaching the tissues indirectly. So the patient will have a characteristic feature, that is cyanosis. I will discuss here. See here. Defect in the interatrial septum. It can be defect in the interatrial septum, or it can be due to valvular stenosis. We will discuss it later. So just imagine this interatrial septum for now. As there is an interatrial septum defect, some shunting of blood occurs from the right to left, bypasses the lungs, it bypasses the lung. So the shunting of blood occurs and the deoxygenated blood gets landed up in the left atrium. And now this deoxygenated blood from the left atrium, it will circulate throughout the body through the aorta. And that causes the patient to have this feature, that is cyanosis. So cyanosis is a characteristic feature of right to left shunt, and these diseases are actually called as cyanotic heart diseases. So right to left shunt diseases, or the heart diseases which causes right to left shunt, they are called as cyanotic heart diseases because cyanosis occurs due to the presence of deoxygenated blood circulating throughout the body. Got it? So this is the basic pathophysiology of right to left shunt, and there are many diseases in which right to left shunt occurs. Okay, so the pathophysiology of those diseases will be the same. In case of pattern foramen ovale, you will have right to left shunt. So the pathophysiology will be the same. And in case of truncus arteriosus, total anomalous pulmonary venous connection, there are many conditions I will be discussing later. Don't worry about that. So in those conditions, right to left shunt occurs, and the pathophysiology will remain the same. Okay, now coming to the left to right shunt. What happens in left to right shunt, you have to know. Same diagram I will draw one more time. So this is the heart, general diagrammatic representation of a circulation of heart. So suppose, consider you have in this interatrial septum defect or interventricular septal defect due to atrial septal defect or ventricular septal defect. These are the characteristic diseases which come under the left to right shunt. Here what happens is, generally if you see blood, I am telling about the normal physiology, blood comes to the right atrium. From the right atrium, it goes to the right ventricle. Then it goes to the lungs. Suppose this is the lungs. Here you have lungs getting oxygenated, and it goes to the left atrium with the help of 4 pulmonary veins. This is normal physiology of circulation of heart, right? 4 pulmonary veins. This is the pulmonary veins. Okay. As oxygenated blood comes here in the left atrium, the blood sees where the pressure is more. Suppose here, in normal situation, in normal persons, the blood will travel to the left ventricle. This is the LV, left ventricle. So blood travels to the left ventricle because there is no septal defect. But here in this case, there is an interatrial septal defect. Now what happens? Blood can pass through this mitral valve into the left ventricle, or it can shunt via the interatrial septum into the right atrium, right? It can pass through the mitral valve into the left ventricle, or the blood can pass from the left atrium into the right atrium. So you can see here whether the left ventricular pressure is more or the right atrium pressure is more. This is the right atrium, right? So right atrium pressure is more or the left ventricular pressure is more. Obviously, left ventricular pressure is more when compared with the right atrial pressure. So what happens is the blood which is reaching the left atrium, they will get diverted towards the right atrium as the pressure in the left ventricle is more. Got it? So the blood gets shunted from the left atrium to the right atrium through the interatrial septal defect due to the pressure gradient which develops between them. Normally the blood has to flow through the mitral valve into the left ventricle opposing that pressure. But here, as the pressure of the right atrium is less, so the left atrium prefers to push the blood towards the right atrium than sending it to the left ventricle. This is the case which occurs in case of the left to right shunt. Okay, now what happens? So left to right shunt occurs. Now blood oxygenated blood. This is the oxygenated blood which was present in the left atrium. Now it came here in the right atrium. And along with this, the deoxygenated blood from the inferior vena cava and the superior vena cava also comes in, and it mixes up with the oxygenated blood here. So the oxygenated blood and the deoxygenated blood gets mixed up in the right atrium, and this flows through the tricuspid valve into the right ventricle, and from the right ventricle it goes to the lungs, and the remaining part of the deoxygenated blood which is present gets oxygenated again, then again transferred to the left atrium, and the left atrium will be filled with the mixed blood now, and this mixed blood, some of them will again get reshunted towards the right atrium, and some of them will flow through this left ventricle, and this little amount go through the aorta and supplies the circulation of the body. So in this condition, whether cyanosis will be present or not? No, obviously cyanosis is not a feature of left to right shunt. That is, they are called as acyanotic heart disease. Why cyanosis is not present here? Because a simple condition, here left to right shunt occur. That means oxygenated blood gets mixed with the deoxygenated blood, but after getting mixed up, they go again to the lungs, gets oxygenated again, and travels to the left atrium. Okay, so generally here you will not see any case of cyanosis, but there in case of right to left shunt, what happens? It bypasses the lungs. The blood bypasses the lungs and travels to the left atrium, so there will be cyanosis. Here it's not, because oxygenation is normal here. The blood is going to the lungs, so oxygenation is intact, so no cyanosis will occur. Yeah, blood supply to the tissues will be reduced, obviously, because some of the blood is getting shunted towards the right atrium and minimum amount of blood is reaching the left ventricle. Obviously, there will be reduction in the perfusion of the tissues, but there will not be cyanosis. That means the cyanosis will not be visualized when you physically check the patient. So this is the pathophysiology of left to right shunt. Hope you would have understood it. Now, let me give you one more point in condition of this left to right shunt. Let me draw another diagram. Now visualize this diagram. Here there is a presence of left to right shunt. Imagine presence of left to right shunt through this interatrial septal defect. Imagine this to be as atrial septal defect, ASD. So what happens is, obviously blood from the lungs, that is oxygenated blood from the lungs, comes to the left atrium through the pulmonary veins, and now this oxygenated blood will get diverted towards the right atrium, okay, and some of the blood will flow through this left ventricle. Okay, now this diverted blood will mix with the deoxygenated blood and gets oxygenated again in the lungs, and that will again travel to the left atrium. Okay, so suppose as this process occurs, you can see here the blood from the SVC as well as IVC also enters the right atrium, and the blood from the left atrium also enters the right atrium. So there is a burden applied in the right atrium, and now this more amount of blood will be transferred to the whole amount of blood is transferred to the right ventricle. This whole amount of blood will be transferred to the right ventricle, and this much blood will be transferred through the pulmonary trunk. Blood from the left atrium, blood from the SVC, blood from the IVC, everything is put together into the pulmonary trunk. So what happens? The pulmonary trunk tries to adapt to this much amount of blood in the form of hypertrophy. Simple. As the pulmonary trunk gets hypertrophy, this all hypertrophy occurs, the lumen of the pulmonary trunk becomes narrow. Okay, as the lumen becomes narrow, resistance will be shown to the flow of the blood, which is in the form of pulmonary vascular resistance. This is called as pulmonary vascular resistance, which develops in response to the amount of blood, that is the massive amount of blood coming from all the three sides, that is from the left atrium, IVC, as well as the SVC. Got it? Now what happens? As the resistance is shown, blood is restricted. So the blood restricted, now the blood gets accumulated in the right ventricle. More amount of blood will accumulate in the right ventricle. So now the right ventricle needs to adapt to that in the form of same hypertrophy. So right ventricular hypertrophy occurs to adapt to this much amount of blood. It needs to pump the blood against the pulmonary vascular resistance. So hypertrophy occurs eventually in the right ventricle. Now this pressure will be transmitted to the right atrium. Okay, back pressure occurs in the right atrium. Now the right atrium also will undergo little bit hypertrophy. It is not that much significant one compared with the right ventricle, but still little bit hypertrophy is possible in case of right atrium. Now what happens? Now you listen carefully. Before why there was shunting of blood from the left to right side, I said because the pressure in the left atrium is increased when compared with the pressure in the right atrium. So the blood gets transferred from the left atrium to the right atrium through the interatrial septal defect. Okay. Now what happens, as there was a pulmonary vascular resistance that causes back pressure in the right ventricle, that in turn causes back pressure in the right atrium. Now the pressure in the right atrium is very much high. In the right atrium becomes higher than the left atrium. Before, left atrial pressure was greater than the right atrial pressure, that causes the blood to go from the left atrium to the right atrium. But now as the pulmonary vascular resistance develops, the back pressure leads to increase in pressure in the right atrium compared to the left atrium. That causes the reversal of shunt. That means the shunt gets reversed. Now the blood will flow from the right atrium to the left atrium instead of going from the left atrium to the right atrium. Got it? This is called as reversal of shunt, or you can call it as Eisenmenger syndrome. Okay, Eisenmenger syndrome, you would have heard about it. So what does it mean? Eisenmenger syndrome is reversal of shunt. Initially there will be left to right shunt, and due to the development of pulmonary vascular resistance, back pressure occurs in the right atrium, which causes it to become little bit hypertrophied, and the pressure in the right atrium becomes increased, greater, and the pressure in the right atrium will be greater than left atrial pressure. So that leads to the reversal of shunt from the right atrium into the left atrium, causing the Eisenmenger syndrome. Okay, now the blood flows from right to left shunt, and the blood will travel through the aorta. In a patient who was initially having left to right shunt, now he has developed right to left shunt. Now whether cyanosis will be present or not? Obviously there will be presence of cyanosis. Here there will be delayed cyanosis, because initially there was left to right shunt. That means no deoxygenated blood. But now as right to left shunt had occurred, all the blood which is coming from the SVC and the IVC, they will land up directly in the left atrium, bypassing the lungs. Okay, so that leads to cyanosis, that is delayed cyanosis in case of left to right shunt. Okay, now let me revise this. Left to right shunt, what happens here? There is a defect of interatrial, or it can be the interventricular septum, depending upon the condition or depending upon the specific diseases. So there will be left to right shunt. Now this left to right shunt will cause the oxygenated blood to flow from the left atrium to the right atrium, and it mixes with the deoxygenated blood, and again it passes to the lungs, gets oxygenated, and some amount will be transferred to the circulation of the body. So there will be no cyanosis. So it's called as acyanotic heart disease. Okay, but after some time, when this condition becomes even more severe, the left to right shunt causes pressure on the pulmonary arteries, so that the pulmonary arteries tries to adapt to this in the form of hypertrophy, and this leads to the pulmonary vascular resistance. Now, as the vascular resistance develops, back pressure occurs on right ventricle, then back pressure occurs on the right atrium. This forces the blood to flow from the right to left area, that is right atrium to the left atrium, also called as reversal of shunt. Now in this, cyanosis will be present, because the blood will bypass the lungs and directly get transferred from the right atrium to the left atrium. Okay, so delayed cyanosis. In case of right to left shunt, there will be cyanosis, but in case of left to right shunt, there will be delayed cyanosis after development of Eisenmenger syndrome. Now going to the classification of these congenital heart diseases. It's simple. Just remember, there are two categories of heart diseases. That is, congenital heart diseases can be classified into two types. That is, one is the cyanotic heart diseases. On the other hand, you have acyanotic heart disease. You know, in cyanotic heart diseases, cyanosis is a characteristic feature and it will be right to left shunt, bypassing the lungs. Okay, so what are the conditions that are present in case of cyanotic heart disease? There is patent foramen ovale. It's a what to say, it's one of the most important conditions we should not forget, and it is the cause of interatrial septal defect. There will be septal defect, interatrial septal defect, which causes the blood to flow from the right atrium to the left atrium. And remaining, you have to remember this 5 T's. In this you can remember this tricuspid atresia, tetralogy of Fallot, transposition of great arteries. These 3 are important, and the truncus arteriosus and total anomalous pulmonary venous connection. You can forget about this, no need to read this now, you can read it in pediatrics later when you go into the final year. Okay, so here you can remember the patent foramen ovale, which is the most important cause of cyanotic heart disease, and the others are tricuspid atresia, tetralogy of Fallot, and transposition of great arteries. Okay, these 3 you can remember, but there are totally 5 T's. Okay, all the diseases we will discuss in subsequent classes one by one. What are the acyanotic heart disease? Acyanotic heart disease means there will be no cyanosis. That means left to right shunting is occurring and mixing of oxygenated with the deoxygenated blood occurs. But bypassing of the lungs does not occur here. And what are the conditions that causes this type of acyanotic heart disease? Are the 3 important conditions. You should never forget this: ventricular septal defect, VSD, ASD, PDA, that is patent ductus arteriosus. And along with these 3, you can remember congenital aortic stenosis and the coarctation of aorta if you want to remember this. Okay, it is also important but not that much significant when compared with these 3 diseases: ventricular septal, atrial septal, and the patent ductus arteriosus. These 3 things you have to remember. Okay, so we had seen what is the pathophysiology behind right to left and left to right shunts, and what are the classification of congenital heart disease, that is cyanotic as well as acyanotic heart diseases. So most probably in the next topic we will go with VSD, that is ventricular septal defect, which is the acyanotic heart disease, left to right shunt. Okay, I will discuss that in the next. In detail we will discuss what is the pathophysiology behind that. Pathophysiology we had seen here, but little bit embryology and what to say, some connection with other systems also I will try to consider there. Okay, so with this let us conclude our session. Meet you in the next session. Thank you so much for being with me.